Peripartum cardiomyopathy is a relatively rare disease that occurs in women during the last month of their pregnancy or during the first few months after delivery. This disease is characterized by a weak heart muscle. Because the heart muscle is weakened, the heart cannot contract enough blood with each beat, resulting in less oxygen delivery to the body. This results in any of a number of symptoms, most commonly fatigue or shortness of breath. Peripartum cardiomyopathy occurs worldwide. The incidence or the number of women affected by peripartum cardiomyopathy seems to vary from country to country. In the United States, approximately 1 in every 2,000 women delivering babies is diagnosed with peripartum cardiomyopathy. What causes peripartum cardiomyopathy? Well, to be perfectly honest, we really do not know what the cause of PPCM is. Once we can determine what causes PPCM, we can better tailor treatments to women with PPCM so as to improve their outcomes. PPCM can be difficult to diagnose, and the diagnosis is sometimes missed because the woman's symptoms are similar to what may occur during normal pregnancy or in the early postpartum period. If a woman experiences shortness of breath, increased swelling, palpitations, or lightheadedness more than what she considers to be normal for her stage of pregnancy or post-delivery, then she should present to her local clinic or emergency department. Once there, the woman must describe her symptoms to the physician. The physician should examine the woman, looking for abnormal sounds in the lungs or the heart, or swelling in the legs or swelling in the neck veins. Any of these findings can suggest heart failure or a weakened heart muscle. After the physician has listened to the woman and examined her, then appropriate testing should be ordered. This usually includes an electrocardiogram or an ECG to look at the heart rhythm, a chest X-ray to look for fluid in the lungs, laboratory tests to look for other causes of the symptoms, and an echocardiogram or a heart ultrasound. Echocardiography is essential because by definition, the left ventricular ejection fraction must be less than 45% to make the diagnosis of PPCM. During the echocardiogram, images will be obtained to look at all of the structures in the heart as well as the blood flow in the heart. If there are other abnormalities such as a heart valve problem or a congenital heart defect, then the diagnosis is unlikely to be PPCM. Treatment of PPCM is similar to treatment of heart failure from other causes. Typically, PPCM moms are treated with diuretics or a water pill, a beta blocker, and an ACE inhibitor or angiotensin receptor blocker. Other potential medications which may be prescribed are nitrates, hydralazine, digoxin, spironolactone, or warfarin. Some moms with PPCM have such severe heart failure that they require additional support beyond medications. This may include implantation of a left ventricular assist device, a biventricular assist device, or even, in some cases, a total artificial heart. In rare cases, PPCM moms require heart transplant. The prognosis of moms with PPCM is actually better than the prognosis of people diagnosed with other forms of heart failure. According to various studies, including the Investigations in Pregnancy-Associated Cardiomyopathy study that was completed here in the United States, at least 50% of women recovered their normal cardiac function within 6 to 12 months after diagnosis. Other women who do not recover their normal heart function within 6 to 12 months may recover normal heart function 1, 2, 3, 4, even 5 or more years later. Among women who do not recover their heart function, a very small percentage will die. In the IPAC study, less than 5% of women died. Unfortunately, this is tragic, and even one death is too many. One of the questions that PPCM moms most frequently ask is, what about subsequent pregnancy? Many PPCM moms would like to have another baby. This question has been studied by various researchers with varying results. We think that approximately 1/3 of PPCM moms may experience a heart failure relapse in a subsequent pregnancy. Heart failure relapse is described as a mom's ejection fraction decreasing 20% or more during a subsequent pregnancy. If a PPCM mom's left ventricular ejection fraction has normalized prior to subsequent pregnancy, the risk of relapse seems to be 20% or less. However, if a mom's left ventricular ejection fraction has not normalized prior to subsequent pregnancy, the risk of relapse may be as high as 50%. There is, unfortunately, a risk of death with subsequent pregnancy, but this risk appears to be quite low. The issue of subsequent pregnancy is a very challenging issue and can be a very emotional issue. There is no single answer that fits every PPCM mom. PPCM moms who are interested in pursuing subsequent pregnancy should discuss this matter in detail with their physicians and make an informed decision. The Peripartum Cardiomyopathy Association, or PCA, was formed to promote education, awareness, advocacy, research, and support to prevent and cure peripartum cardiomyopathy. I invite you to visit our website, ppcmassociation.org, for further information.